Okay, case study number 2. Disclaimer, I think part of case study 2-1 is missing because I couldn't find an answer for one of the lower case study questions within what was in our PDF. But here we go. Case study 2-1, displaced fracture of the femoral neck. While walking home from the train station, MA, a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. MA was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given spinal anesthesia and positioned on an operating room table with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip and abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case study 2-2, intertrochanteric fracture. AR, age 88, slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called for an ambulance. AR had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right intertrochanteric fracture. Intraoperatively, Mr. R was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compression screw and a side plate with screws. His postoperative recovery was unremarkable, although he was at risk for deep vein thrombosis, that is, blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Case study questions. Write a word from the case histories that means the same as each of the following. Number 1, replacement of half of the joint component. Should be hemiarthroplasty, but that is not within the case study, so I believe that part was missing. Number 2, substances that act against microorganisms, antibiotics. Number 3, in a position away from the midline of the body, abduction, ABDUCTION. Number 4, position toward the midline of the body, adduction, ADDUCTION. Identify and define the prefixes in the following words. Number 5, displace and dislocate. Prefix is dis, D-I-S. The meaning is away from or reverse. Number 6, replacement and rehabilitation. Prefix is re, R-E, which means again or back. Avascular, prefix is A, which means without or lack of. Anesthesia and analgesic, prefix is AN, an, which means without or lack of. Number 9, orthopedic, prefix is ortho, which means straight, normal, or correct. Number 10, externally, prefix is X, EX, which means out, outside, or outward. Number 11, bipolar, prefix is bi, B-I, which means two, as in the number 2. Number 12, unremarkable, which the prefix is un, UN, which means not. And next was fill in the blank. Number 13, the adjective for the operative time span from decision for surgery to placement on the operating table is preoperative. Number 14, the adjective for the operative time span from placement on the operating room table until transfer to post-anesthesia recovery unit or intensive care unit is intraoperative. Number 15, the adjective for the operative time span from admission to post-anesthesia is post-operative. And that was case study number 2. Thank you.